Hi there, my name is Kendall Traylor, and today I will be discussing a few orgasmic disorders in hopes of educating you all on how psychological and physical factors can affect various sexual performances. And I'll be covering male and female orgasmic disorder as well as premature and retrograde ejaculation. So, firstly, female orgasmic disorder is simply the difficulty or inability for a woman to climax during sexual stimulation, and the orgasm is either reduced or completely absent from the woman. And luckily for some, this disorder is more likely to be a temporary or acquired rather than permanent. So sometimes the condition is caused by certain partners as well as different situations or types of sexual stimulation. So a lot of times through therapy and different diagnoses, they can have it treated and it won't be permanent. So in order for a woman to be diagnosed of female orgasmic disorder, she has to have a significant amount of stress and anxiety in her life that has been going on for at least 6 months, so the doctors can diagnose that that's actually the issue and not just some other anxiety-based disorder. And a woman can easily be affected by relationship problems, drug, alcohol problems, and sexual abuse, as well as physical and mental health. So really anything that is going to be affecting us physically or mentally can be an issue for this disorder. And for treatment, sometimes hormone supplements can be helpful, but for women, the most helpful sources are usually sex therapy and couple therapy that can help partners communicate more and better with each other. Secondly, I will be discussing male orgasmic disorder, which is very similar to its female counterpart, as you can assume by the name. So this disorder is caused by all the same things as female orgasmic disorder, usually physical, mental health, as well as past history of drugs and physical abuse. But for males, usually it is more affected by their hormones, and a lot of times the disorder can be caused by genital or spinal cord injuries, as well as pelvic trauma, low testosterone, effects of depression medication, and also thyroid complications of low thyroid. So as for treatments, it's more common for men to be treated with hormone therapy because a lot of times it is a testosterone deficiency. So it's usually significantly more effective for men to do hormone therapy versus women doing hormone therapy. Usually their treatment is a lot more discussion based of getting to the root of the issue. So for premature ejaculation, as you can see in this sad man here, it's simply when a man climaxes sooner than he is wanted to, and it seems like something that we would stereotypically characterize for a young teenage boy that doesn't really know what he's doing, but it actually, roughly 30 to 40% of men have had this happen to them in a lifetime, so it is very common. And just like the other two disorders I talked about previously, usually stress, depression, anxiety, and relationship troubles can be a cause of this. And it can also affect men that have had pre-existing issues with erectile dysfunction. So a lot of times treatment can help if you treat it the same way as if you would of erectile dysfunction, but there are many common medications that can affect these men as well, just like male orgasmic disorder. So a lot of times, if you treated it like it was erectile dysfunction by taking Viagra, usually that helps men lessen the cause of the issue, because if you're going to treat erectile dysfunction, a lot of the men that have ER have premature ejaculation. It usually goes hand in hand. And then for our last one, I'm going to discuss another sad man for retrograde ejaculation. And retrograde ejaculation is an ailment where semen is actually redirected into the bladder because of just the passage of the urethra. So we know here we have a diagram of the male anatomy, and so for retrograde ejaculation, so the semen will be going through the vas deferens and going through the urethra, but a lot of times it's redirected and going to the bladder instead, and that is the issue. And of course, most of the time, the sphincter outside of the bladder stops the semen and just closes and redirects the semen back to the urethra. But a lot of times, the telltale sign of having retrograde ejaculation is when a male has orgasmed and he has not ejaculated, because if the sphincter muscles aren't working properly, then they won't close in time and the semen will just go into the bladder. And sometimes I read that sometimes men actually do this purposefully and somehow train themselves to do it because it's a form of birth control, because of course if semen's not released through the urethra during sex, then you cannot impregnate the person you're with. So it's not really dangerous for men, but a lot of times it can lead to infertility because they cannot impregnate their partner if it lasts longer. And if the condition continues to affect them, a lot of times the causes are different medications, like for heart disease as well as high blood pressure. And then some men are affected when they have diabetes, prostate issues, nerve damage, or even surgeries that could have impacted their bladder muscles. So the treatments are usually stopping the medications that could be causing it, possibly minor surgery in the bladder, or doctors can also prescribe medication that can help strengthen the bladder muscles so the sphincter closes more efficiently and stops the semen from entering. So if you feel that any of these conditions have affected you or a loved one, it's best to see your physician as soon as possible so you can have the best out of your sex life and not worry about any possible issues in the future. So if anything here sounded familiar, you should always ask questions from your doctor and discuss what you can do to move forward.